Hello and welcome to NJCDC's The Loft. Today, I welcome the Americorps Public Health Director, Maryam Ali. Hello, welcome to the show for the very first time. How are you?
Hi, Dan. I'm very excited to be with you today. This is my very first time actually conducting a podcast, and I'm very excited for it to be in public health and about our new program, Americorps Public Health.
Before we get into the actual, program itself, I want to talk a little bit about yourself. Can you give us like a little introduction? Like tell us who you are, how you found NJCDC, etc.
Sure. So, my name is Maryam Ali. I am currently the Public Health Americorps Program Director at NJCDC. And to give you a little background about myself, I started school at Montclair State University. I did choose to pursue a career in public health. Initially, I was going towards, medicine. My passion was about pretty much helping people and just being there for them and making this world a better place, at least to be a part of that. And then I found public health. So, it gave me a spark that, public health is a great way to also reach a lot of people. And if like a doctor reaches a patient one-on-one or like gives treatment to one patient at a time, a public health specialist can actually do that in a broader, aspect where they can help many people at the same time. So 10, 15, whether it be a community or like a whole city or whatever the case may be. So that made me actually want to pursue public health as a career. And so I did my undergrad at Montclair. And then I went ahead and completed my master's at the Rutgers School of Public Health.
Nice.
Okay. And graduated from there. During that time, of course, I had conducted a couple of internships. I did work as a public health specialist. I worked at the airport at the Newark quarantine station where I oversaw different procedures of infectious disease and, inspecting travelers and all of those things. So that was also very, very nice. And that's the cool thing about public health. Like there is so many routes that you can take. And it's a good way to like even explore yourself. There is no one setting. Like you could do so many things at the same time. Right now I'm a doctor candidate too for the School of Public Health at Rutgers.
Okay.
So hopefully that works out fine.
All right.
As you can tell, I'm very passionate about this career.
Yeah, most definitely. Okay, that's great.
Yes. And I found NJCDC actually online, and I remember having like my first call with Dave Gelman, and he was very excited to hear about my background, and like we just took it from there. And since I've joined NJCDC, it's been a pleasure because I actually get to implement everything I've learned in my past experience and implement it into that whole new program. And it has been a great pleasure just to see the program grow from scratch and just, building it from scratch, recruiting the members and everything in between. It has been
for sure.
A great blessing for sure.
That's great. That's great. So for those who may not be aware, can you give us kind of like a broad understanding on what public health is? I know it's like you could go, there's a lot of avenues like you said, but
sure.
If you could give just like a brief overview, just to give us an idea.
Sure. So I'm going to go by like the actual definition. So public health is the science and practice of protecting and improving the health of communities and populations. And like I said, unlike medicine, which focuses on treating individuals, public health works to prevent illness, promote wellness, and address factors that influence health at a broader level. So in this case, our program targets students and their families at the broader community of Patterson. And so that's pretty much what public health is. It focuses more on prevention and improvement of the quality of life of individuals.
Okay, perfect. Thank you for that.
Of course.
So can you give us kind of an overview of the Americorps Public Health Program in general?
Yeah, absolutely. So the Americorps Public Health focuses, again, on students, specifically on mental health. Right now, we're trying to, build on students to seek out for help when needed, especially after COVID-19. Isolation has been an issue. And it has exacerbated the students not being able to communicate very well because they stayed a whole lot of time behind like the computer screens and whatnot. So a lot of them faced many challenges, and getting back to school settings, it has been challenging to do well on their grades and maybe focus, maybe seek for help when needed.
Hmm.
So our program targets the students in trying to raise their awareness on different topics, and specifically mental health, and seeking out resources. So Patterson, as an underserved community, we were trying to do our best to actually have a resource available for those students. So in our program, we have 10 members recruited, and they are a mental health member, well, public health, mental health mentors,
Okay.
and they act as a resource for the students. They conduct one-on-one sessions for them. They direct them to different resources, and they also conduct different workshops or seminars monthly to try
Okay.
and reach out to a larger group of students, and to also again raise their awareness on different mental health topics based upon their age group, just to be able to seek out for help or reduce stress levels, stress management, different things that students may face and may get in the way of them doing well academically. The
Okay.
mental health mentors and public health Americorps members are there to assist with that.
Okay. And where are you guys located? Like, where do you do your services?
Yeah, so we're actually focused on the school system.
Okay.
So we are currently in different school sites.
Okay.
So five.
School 5. Okay.
No, not only school five,
Oh.
five
Oh.
different
Oh.
locations. So
Oh.
five different
Yeah. Yeah. Yeah.
schools.
Okay. Okay.
I have them on top of my head. So like International High School, JFK.
Okay.
We have School 5, CCSP, and we have one more, Joseph Top.
Okay.
So those are the main schools, and they're all kind of grades, like from K to 12. So
Mhm.
we try to again work with them based upon what level and what age group they are.
Yeah, for sure.
The public health mentors also work with them on like fun activities to try and empower them, and build upon their confidence,
Yeah.
and just have them feel comfortable where they are. And that definitely reflects back on them doing well academically and doing well even at home.
Yeah, for sure.
Mm-hmm.
Something that came to mind now is that, you know, earlier last year, I interviewed Gabrielle Fushi, who was
Sure.
the NJCDC's AmeriCorps director.
Mm-hmm.
And so, like, I've like, if I was a viewer watching now, I might get a little confused as to the difference between AmeriCorps Public Health and just the AmeriCorps program. So
Sure.
can you kind of like explain some of the differences specifically for those who are listening?
Yeah, no, and thank you for bringing this up. So, Gabrielle Fouché, she's the director of the AmeriCorps educational program, and
Okay.
they usually focus on to like educating and helping students with like challenges that they may be facing in terms of education, so they
Okay.
can tutor them or like help them with whatever challenges they may be going to in terms of education.
Yes.
Our public health program focuses more on the health and well-being of the student, and providing them with different mental health resources as needed. So we're both AmeriCorps programs, but at the same time we have different
Yeah,
focuses.
most definitely, most definitely. Is do you guys see yourself like in conjunction a lot with within like the schools and like your
Yeah, our members actually work together. Sometimes they're in the
okay.
same settings, and a lot of them are familiar with each other, which is great, just to have
Yeah.
somebody there at the same site, doing similar work. Well, not necessarily, but still there at the same, like under the
Yeah.
same program.
Yeah.
Gabby and I work very well together. We attend
Oh, okay.
meetings together for AmeriCorps. AmeriCorps is a very big, I want to say, an organization.
Mhm.
It's like a national wide organization at
Mhm.
different states and different cities, and all of the directors work to do different things across the nation.
Mhm.
Like some of them focus again on public health, some of them focus on education, some of them focus on like clean waters, and it's just everything you
Yeah.
could think about. So it's pretty cool.
Yeah, that's great. Okay, so can you speak on some of the more specific initiatives that you guys have implemented in your programs? I know you guys have like monthly seminars and you have your peace rooms. Can you explain what those are and what other stuff you have going on?
Yes, so we try to work with the school administration to again be that resource for the students, and for them to have somebody whenever they need to come in and speak about something that may be bothering them, or a challenge, or maybe like some guidance that they may need help with. So that public health mentor is always there for them to assist with that. We also created peace rooms within each site, which is technically a safe space for a student to express their feelings and speak about anything that may be bothering them.
Okay.
And also to feel comfortable to walk in and ask for any help for them or for their family. So maybe a student would have some difficulties even at home with, like, I don't know, maybe nutrition or whatnot, and our specialists, they can probably help with getting them into program like SNAP or whatnot.
Okay.
Maybe if a parent is having difficulty getting like healthcare coverage, our members could assist with that. We
Okay.
also try to collaborate with like the health clinics on the schools to try to conduct different health fairs and try to introduce the parents to different resources available, whether it be like health insurance or getting that help or that extra help that they may need.
Okay. And the peace rooms, are those kind of like the base of operations for AmeriCorps Public Health like sites? I suppose. Like I know
Yeah.
they're probably, I don't know if they're like in, I guess, in classrooms and whatnot
Yeah,
as
no, they're
well.
not in classrooms.
Okay.
It's technically a designated space solely for the members of the Public Health AmeriCorps and for the students to come in. Like I said, it's probably like a private room, where students could come in and speak to their mentor and
Okay.
express their feelings freely and ask for help as needed. Because sometimes in the classroom, or if there is anyone, they may not feel comfortable at seeking the help that they may need. So
Okay.
that's why I find peace rooms are important for that
Most
reason.
definitely. Most definitely. That sounds great.
Yeah.
Um, so when you have a student coming in to your program and you're sitting down to talk with them and you have like a student kind of like ongoing for like a period of time, like how do you measure the success of your program with that student?
Yeah, that's actually a great question. So the way I set up my program is I try to have each member follow a certain agenda
Okay.
and keep track of a caseload of the students that they are actually serving. So for each site, I have placed a target number of students to be reached at each site. So what the mental health or public health AmeriCorps member does is they keep track of every person they served, and they also administer surveys to be able to evaluate that student's progress. So
Okay.
maybe if they give like a seminar or presentation on a certain topic, they would later on survey them and ask them about it and see if they actually have implemented certain certain measurements that they have learned or they have actually um, used later on in the future. And so
Okay.
after collecting those data, we actually analyze them, and then we see like if the students is actually making progress. And so far, from the first year, we've seen a lot of progress in those terms, that the students have learned a lot and implemented a lot, and a lot of them, they feel safer, they feel more confident to try and ask for help. Growing up myself, I tried to have a mentor each place I went to. So
Okay.
if I was like at school, I would have like maybe one of my favorite teachers be my mentor. I would go to her if I'm having difficulty. But again,
Okay.
she's not my official mentor, so I can't just walk to her at any time.
Yeah.
So the good thing about the AmeriCorps program is that they know they have someone to go to
Yeah.
at any time that they need, and they actually um, created like a good relationship with their members. Even outside of the school settings, they could always like send a message on like um, on I'm trying to remember the name, group me, for
Oh,
example. They
okay.
have like a group me together, and they could like ask, oh, like if maybe the member is not in, are you coming in soon, so that way I can schedule an appointment to speak to you one on one, or when is our next seminar or whatever. A lot of
Okay.
students find themselves doing that, and they actually have something to do, like they're more engaged into the program, which is great to see.
Yeah, that's great. Yeah, a resource definitely very needed. So that's,
Absolutely.
yeah.
Yeah.
Can you speak on a little more specifically on uh what topics you guys talk about on your workshops and in your seminars?
Like I mentioned previously, we try to take the main focus on mental health, especially after COVID. That may shift in the future, but for now, we are actually focused on mental health. So, one of the things we try to make students aware about is the stress management, so mindfulness, meditation techniques, the impact of stress reduction, time management strategies
Okay.
for reducing academic stress, sleep, how to improve that during busy times for sure. As a student, that can
Hmm.
get very challenging. Identifying and managing burnout is also another thing. Another topic we discuss is emotional well being. So, coping mechanisms for anxiety or depression, building resilience in the face of academic challenges, the role of gratitude and positivity in mental health, the importance of emotional intelligence and for mental health well being, different therapy measures. So, whether it
Okay.
be music or art, We also have like social and peer support, mental health awareness and education, recognizing signs of mental health struggles, breaking stigma around mental health, understanding and accessing mental health resources,
Okay.
um, a lot of different things, healthy lifestyles and habits, nutrition, connections between screen time and health and well-being
Yeah.
overall. So things like that.
Yeah, I mean, I'm sure that's like information that is going to be useful even outside of, when they leave high school, or like
Absolutely.
wherever, or like middle school or wherever
Yes,
they are.
absolutely.
So that's great though. That's
Yes.
great. So obviously, like, you're very passionate about
Yes.
public health, right? And you sound very passionate about like your position here, NJCDC. Can you talk about kind of what's been the most rewarding aspect of this so far, of your experience here in these past, like, I think 2 years, right? You said.
Yes, almost 2 years now. I want to say the most rewarding aspect is just knowing that we're making an impact on communities and on the life of students. So if you get to make one person's life better, that's just a great accomplishment. And that's why I
Yeah.
decided to pursue that career in the very first beginning of my journey. And even with my members, they I actually feel very proud when I hear from them words of, gratitude. And they always, say that I'm there for them as well. And since they themselves, they go through a lot too, I try to be their mentor. So they
Yeah.
always come to me if they need assistance in anything that they're going through, whether it be
Okay.
actually them being at the school settings or even outside with
Yeah.
their academic journey in like public health, because a lot of them are in public health
Yeah.
too.
That's great.
Yeah.
Yeah. Is there any, like, do any success stories come to mind when talking about these things?
Yeah, for sure. So Americorps itself is a service position.
Mm-hmm.
So technically you don't get a set salary like like a regular position,
Mm-hmm.
right? So a lot of members actually they either go to school or they try to find a full-time position while doing that or after finishing their year of service.
Mm-hmm.
So the rewarding part is or the success stories, I want to say, a lot of the members, they actually didn't want to leave after the first year of service, so they actually
Oh,
wanted
wow.
to continue doing that. And I feel like that stems from mainly two things. One, they're passionate about what they're doing. Two is actually having that healthy environment of work.
Mm-hmm.
And I try to be there and work on their personal developments in the first place. Like,
Yeah.
sometimes I feel like they're moms at this even though
Nice.
some
Yeah.
of them are older than me,
Yeah.
but
Yeah.
still,
Yeah. There you
I
go.
really look out for them. So
That's great.
I'm really happy that almost all of them, they want to continue with us for going forward.
Yeah.
That's one thing. Another thing is a lot of them are very successful. So many of them are grad students, and um, one of them has recently uh, got a job at the Rutgers Tuberculosis Center.
Oh, wow.
Yeah, her name is Iram, and she's still continuing with us at the same time. So she still didn't want to leave,
Oh, wow.
which is great. That's I like to see
Nice.
them improve in their own like personal development, their academic journeys as well.
Earlier, I mentioned that you've been in this position for almost 2 years, right?
Yes.
So what were the challenges you faced over these 2 years that you really had to address that was very difficult?
Sure. So, just starting a program from scratch, like a brand new program, and trying to
Oh, yeah.
have like a foot imprint in each site where nobody actually knew about this program before, or they didn't know some people didn't know like what the members are here for. So it was kind of challenging at the beginning to try
Mhm.
and introduce ourselves to each site and to the students and try to have more engagement from the students. And that's something we're still working on. We have seen great improvements, but I'm still eager to reach more and more people.
Yeah.
So that's definitely a challenge. And also, just learning the technicalities of
Yeah.
everything. For me as the program director,
Mhm.
it was challenging, of course, but because I know it was rewarding at the end, I still had the passion to go through with it. But of course, there was days that it was just
Yeah.
over the
Yeah, for
top.
sure.
Yeah, and it was also challenging for me to try to build my team, because I feel like in order to have, like I mentioned before, like a healthy working environment, it's very important to focus on a team that could actually look out for each other and to
Yeah.
help each other,
Yeah, for sure.
especially that we're recruiting um on like at a different pace. So there may be somebody that started today and then somebody starts after 1 month later. So
Yeah.
I just want to have them all have that good relationship with where they can all work together and assist each other. And also, I wanted my members to all have a solid background in public health, which was a little challenging. So I try to use, my previous like networks and stuff like that to try and recruit exactly, because it's not easy at all. And also, I tried to have like a very diverse team. So I think like my team have 5 different languages spoken, including French, Bengali, I believe like Haitian, and they come from all different backgrounds. That's so great. It's great to see that diversity there.
And then have you reached that goal of like are all of your members like in public health backgrounds?
Yes.
Oh, okay.
And that was the challenging part.
Yeah. I mean, I can imagine how long that must have taken.
Yes.
But that's great though. That's great.
Yeah. No, I'm happy. I'm happy with them.
Are there any future goals you're looking forward to, like 2025 and beyond for the program?
Sure. Yeah. So I'm looking to definitely reach more people, reach more students, and get more engagement. Hopefully, like try to like host different events at a broader level for families and students to both come and benefit from. So that's what I'm looking forward to.
Okay, that's great. If there are any like listeners out there that want to support the program, how would they go about doing that?
That would be great. I think we have like a personal blog at NJCDC where it mentioned our program, Patterson Public Health Corps or Public Health Americorps. They could always reach to like Bob Garachi, Dave Gelman, and myself. And, we can always, we would always appreciate anyone supporting the program, of course.
Okay. That's great. If there's like one key takeaway that someone watching this can have about the importance of public health and your program and mental health with the students, like what would you say for that person or for those who are listening?
This is a great question. I guess I would want to, say that the biggest takeaway would hopefully educate themselves on public health and the importance of it, because anybody could benefit from public health. Yeah. And probably putting themselves in like the shoe of somebody that may need the assistance. So even if I don't have children now, like just think if I were to be a student back in the day and I would have that type of resource, how would that make my life different? And that way you get to see a clearer picture and how important public health can be in impacting others' lives.
All right. Well, thank you so much for coming here today. Very excited to have you on, and hopefully it won't be the last. So
thank you, Dan. I think this went very smoothly.
I think it did.
Thank you for a great experience.
Yeah, of course.
I appreciate it.
I try my best.
No, thank you. You're doing great. You're doing great work. Thank you. Thank you for putting us out there.
Yeah, of course.